Hi, my name is Lakeisha Edwards, and I chose to do my disease project on pneumococcal pneumonia. The pathogenic organism is Streptococcus pneumoniae, or S. pneumoniae. It has a dense capsule that makes it resistant to phagocytosis. It's a gram-positive ovoid bacterium, common cause of otitis media, meningitis, and sepsis. Streptococcus pneumoniae can be isolated by sampling sputum coughed up from the lungs. The sputum may be blood tinged, meaning there may be specks of blood in it. To culture it, you observe the inhibition of growth next to the disc of obtrusion. Biosolubility test. And you can also do a latex indirect agglutination test. It detects a capsule antigen of Streptococcus pneumoniae in the urine. It's 93% accurate, and you get a diagnosis within 15 minutes. And these are just pictures of the inhibition of growth next to obtrusion disc and biosolubility test. Right here you have the Streptococcus pneumoniae lysed by the bile. And this is just a picture of the latex indirect agglutination test that takes 15 minutes for results. It's acquired by direct contact with respiratory droplets, such as coughing, sneezing, or talking. Autoinoculation in people carrying the bacteria in their upper respiratory tract is also a way that it's acquired. Influencing factors often spread within households or crowded conditions, common during winter and early spring. Mechanism by which Streptococcus pneumoniae causes disease is it colonizes the mucosa of the upper respiratory tract, and carriers can shed the Streptococcus pneumoniae in nasal secretions. Signs and symptoms include cough, fever, chills, labored breathing, chest pain, increased heart rate, fatigue, nausea, diarrhea, bloody mucus, delirium, confusion, low body temperature. And the low body temperature is usually for those older than 65 years old. Sweating, low oxygen levels, and weight loss. The diagnosis is determined by a physician through signs and symptoms. A CBC may also be done, which is a complete blood count to see if the immune system is fighting infection. Chest x-ray may be done, or a CT scan, which is more sensitive for pneumonia detection than a chest x-ray. So it's usually a clearer picture for the pneumonia in the CT scan for the doctors to see. And these are just pictures of pneumococcal pneumonia in the lungs. It will be the areas where the white is. And then this is an animated picture of it with the Streptococcus coming out of the area of white where it's detected on the x-ray. Treatment will be broad-spectrum cephalosporin until results of antibiotic sensitivity testing is complete. Mild to moderate pneumococcal pneumonia treatment would include oral amoxicillin or other beta-lactam antibiotics, which are the cillins, macrolide, fluoroquinolone. Severe pneumococcal pneumonia treatment will be IV route of ceftriaxone, cefotaxime, and amoxicillin clavulanic acid. Prevention would be the vaccines, and one vaccine is the conjugated pneumococcal vaccine. It is effective in preventing infection by 13 serotypes included in it. It has also shown effective in reduction of otitis media attributable to pneumococcus. And the other vaccine is the pneumococcal polysaccharide vaccine, recommended for people with asthma and older adults. Protects against 23 strains of the bacteria. And I want to thank you again for listening to my presentation on pneumococcal pneumonia.